definition is a superficial, is a resurfacing procedure by the use of topical agents, which are designed to sort of eliminate dead skin cells, improve cell renewal, and provide rejuvenation. So they are used to. It's a procedure that is very commonly done in dermatology clinics. One of the most basic procedures that we learn during our residency. But even today, even after all these years, they still have their role, and they're one of the best treatments, one of the gentler treatments, one of the best treatments to achieve skin rejuvenation. They help in a lot of medical, in a lot of dermatology conditions such as acne, rosacea. Then they enhance dullness of the skin with poor skin texture. Conditions like pigmentary demarcation lines, they help sort of improve the appearance of pigmentary demarcation lines. In conditions of hyperpigmentation such as melasma, in acanthosis nigricans. And not only this, they are used for rejuvenation and even to improve the results of topical treatments, because a lot of the times we commonly prescribe skin rejuvenating creams and anti-aging creams, which may not have very good penetration, and peels are a wonderful way to enhance the penetration of these products and achieve the desired clinical outcomes. Peels can also be used on the not just on the face and the neck. We also use them on the body, such as for conditions like keratosis pilaris, acanthosis nigricans, for tan removal. A lot of the times we use it before some weddings or events. So there are wide-ranging indications, and peels are a wonderful therapeutic modality. Today we will sort of demonstrate the use of Amira peels, which have been around for about 6 years. My experience with them has been since the last 1 year, and I find them very useful in the treatment of multiple conditions. So and they're useful in the gels. There are various gels. Today we will demonstrate the use of 4 peels. One is the cocktail peel, which has it's a combination of. So the peels are a combination of alpha hydroxy acids and beta hydroxy acids in hydroalcoholic vehicles, and with added propylene glycol and carboxymethyl cellulose as agents which improve the viscosity, so that the penetration can be more uniform and gradual over a period of time rather than immediate penetration. With Indian skin tones, with Indian skin, we have to be a little more gentle and not be very aggressive. And these peels are classified as very superficial to superficial peels. We know by classification, peels are divided into very superficial and superficial, which are limited to the epidermis, and you have medium and deep peels, which are which involve varying, which penetrate to varying depths in the dermis. And we don't use those medium and deep peels very rarely in Indian skin. I mean, I don't use that in clinical practice, but very superficial and superficial peels are the ones that we use. The pH range of the peels that I'm going to demonstrate today ranges from 1.1 to about 2.9. So they are quite acidic, and that is important to achieve a good epidermal exfoliation. Peels also have multiple. Peels are a treatment modality where we recommend to a wide range of patients, and it can be a really good starter treatment in the whole process of rejuvenation. And sometimes a lot of patients are sort of I mean, they are a little guarded about going into any aesthetic procedure, especially when you recommend them lasers. So peels are a very good way of getting them to start on some in-clinic procedures, and they give great results, and they are quite pocket friendly. They are quite affordable to patients. So that this could be a very good starter treatment, to get your patient's confidence into the treatment. And a lot of the times, patients just want a simple glow. We do a lot of advanced aesthetic procedures in the clinic, but sometimes a patient just wants a simple glow, or they just want their acne and acne marks to clear out, and peels are a wonderful way of achieving that. So generally in my practice, what I do is, before putting a patient on peels, I do prime them. This is to improve the cell renewal and to prepare the skin for the peel. This achieves uniform epidermal turnover, and it achieves uniform penetration of the peel. So generally, it could be a retinoid or a glycolic acid or a hydroquinone or a combination of some depigmenting agents, which I start usually 2 to 3 weeks before the treatment, and I ask them to stop this about 3 days before the peel procedure. And generally, after the peel procedure, I give them emollients, occasionally a mild topical steroid to reduce irritation, and insist that they wear a sunscreen at all times during the daylight hours. And nowadays, with increased device exposure, we do ask them to continue sunscreen till late evening. So this is the an overall outline of what we generally do with when it comes to peel treatments. I'll start with the first demonstration. We'll demonstrate a peel called as the yellow peel. Uh, so yellow peel, as we know, it's called yellow peel because it's yellow in color, and all dermatologists would know by now that yellow peel is because of the color of retinol in the peel, which is vitamin A derivative, uh, which gives the peel its yellow color. So the yellow peel has two parts to it. The first part is a vitamin C solution, which is 30% of sodium ascorbyl phosphate. So we take about 2 ml नहीं अभी हाँ प्रिपेयर करो. So the solution contains 30% of sodium ascorbyl phosphate, which is a stable vitamin C derivative, and we know that the ester undergoes the compound of vitamin C undergoes hydrolysis, and it releases free vitamin C or L-ascorbic acid, and L-ascorbic acid, and that vitamin C has multiple broad-ranging benefits with the skin. It's a very potent antioxidant. It's important for um, uh, synthesis of collagen in the skin. It also inhibits tyrosinase, so it enhances the tone of the skin. Because of its mildly acidic nature, it also achieves ये लगा लो all over the face and neck. Okay, उसके पहले so you can use this एक ये pre peel cleanser use कर लो. Actually एक मिनट acetone से ये कर सकते हो. अपने पास acetone है ना, या alcohol swab ले लो. So we'll degrease the skin with the so yellow peel. The indications are it can be used in anyone who has photo damaged skin, anyone who has dull skin, if there is a PIH like acne, who has anyone who has post-inflammatory hyperpigmentation because of acne or any other dermatitis on the face, or any because of any injury. And these are the patients. Typically, yellow peel we would prefer in a patient, also in patients who cannot come to the clinic very often, who can come to the clinic say only once in 6 to 8 weeks. This would be a good peel. And I find yellow peel very useful in men, where the skin is generally thicker, and it requires a little bit of intensive epidermal exfoliation in order to achieve a good depigmenting result. So the step one is to apply the vitamin C, the sodium ascorbyl phosphate solution evenly all over the face, neck, right up to the under eye. And after that, the solution is lightly sort of massaged into the skin with manually. So the pack contains 6 vials of sodium ascorbyl phosphate and 6 sachets. So the sachet contains retinol 0.5, so it contains retinol, salicylic acid, azelaic acid, and pyruvic acid. So we know retinol is vitamin A, and it's the active form of vitamin A, but it's milder than retinoic acid. And what it achieves is mainly it achieves improved epidermal turnover. It's involved in epidermal keratinocyte differentiation and maturation. And when we apply it in high concentration, it achieves desquamation, keratolysis, but at the same time, it increases the epidermal cell turnover and thickening of the epidermal cell layers. थोड़ा लगेगा तो लगा लो है, put a thicker layer. So after degreasing the skin, we apply the solution and then manually massage it. The other ingredients in the formulation are azelaic acid. Azelaic acid, as we know, is very commonly used in dermatology now. It is derived from wheat germ, or in the skin it's already produced from Pitiosporum ovale. It's a dicarboxylic acid, and again it achieves keratolysis, improved epidermal turnover, but it's one of the most important functions is tyrosinase inhibition, and that helps improve the overall, helps achieve a even skin tone. It helps with acne and acne prone skin, and in conditions such as melasma, it's very useful. So in this, the concentration of azelaic acid is low than what we use clinical strength, but the reason is we have penetration enhancers like salicylic acid, which will improve the penetration of the azelaic acid and help achieve a clinical result. So the other acid that is used is salicylic acid, which is a beta hydroxy acid, and again it has a very potent keratolytic effect. So where you want to achieve a good amount of epidermal exfoliation and keratolysis, it's very useful in those. It's very useful in those conditions. And the other one is pyruvic acid, which is a keto acid. Again, it has the same sort of epidermal effects. It's a milder acid, and that's why it can be left on the skin for a long time. And it sort of helps enhance the effect of the other components in the formulation. So where I would use yellow peel would be, as I said, in simple dullness, in tan removal, in conditions such as acanthosis nigricans or maturational pigmentation, where a lot of the times patients develop this dark band on the forehead, dark bands on the or dark patches on the cheek, not pigmentary demarcation lines, but mainly because of acanthosis nigricans, including under eye dark circles. So all of these conditions we can use एक sachet कर लो, half sachet use कर सकते हो. So in all those conditions, we can use in acne and acne-induced PIH, in melasma. So typically where you want to achieve an enhanced epidermal exfoliation without really irritating the skin, and you want to rejuvenate the skin, where in conditions where people have photodamaged skin and fine lines or slightly deeper lines. So those are areas where those are the conditions in which you would prefer this peel. So after we apply the vitamin C solution and massage it in, the next step is to apply the yellow peel cream. So initially the recommended time for leaving this peel is about an hour, but it's better to start off with lower contact times. And the sachet contains 6 gram of the peel cream, and we prefer we can use it on 2 patients. Although it's you can each sachet on 2 patients, and typically we start with a 1 hour contact time, but you can extend it up to 6 hours with subsequent sessions, because there is a lot of because there is salicylic acid in the formulation. The penetration is quite good, so, and the exfoliation is also quite good. So generally what can be expected after the treatment is, after 1 hour the patient is instructed to wash the wash the product out, you can either get the patient to wait in the clinic, or you can send the patient home and ask them to wash it off after 1 hour. Although the recommendation is to use a neutralizer to wash off the product, but you can actually wash it off with plain water. And the post-treatment care would be to use an emollient, a moisturizing cream for the next 5 to 6 days, okay, 2 to 3 times in a day. Typically, the patient can experience some exfoliation from on the third, fourth, and fifth day after the peel, after which it sort of settles down. The recommended interval between two treatments is 3 to 4 weeks. A patient can start their actives after a week of the procedure. So generally, typically I ask my patients to start it about on the 6 to 7 day after the procedure, and then I ask them to continue with their actives, and then stop the actives about 5 days before the procedure. Before the next procedure. So generally we time it, as I said, because it's an intensive peel. You can, if they are on a strong topical regimen, you can even call them at 6 to 8 weeks, because typically yellow peels are a little expensive than your regular short contact peels. So patients may find it in their a little bit of an expensive affair. Or this can be a very good starter peel. And you can follow that up with alpha hydroxy acid short contact peels later on. So this is how. So there are multiple ways that this can be used in a regimen. Or even if a patient has already been on other like a treatment regimen of multiple short contact AHA peels, this can be used to sort of enhance the result further. You can give it a break and then do one yellow peel in the middle, and then follow it again with your AHA routine. So anyone who's patients who say that like I've been doing peels repeatedly, but I don't think the results are improving further, this would be a good way of improving the results further. And as I said, this can also be used on the underarm, for underarm and flexural darkening. So the underarm area, the groin area, all those areas can be also treated with this peel. You can expect a good amount of improvement. And as I said, I do a lot of yellow peels in men who want some amount of skin brightening, because they require a good amount of epidermal exfoliation, and that gives very good results. So this is how it would. So with the finger, you can just gently sort of massage the product in, and then leave it on. If the patient experiences any redness or irritation, we ask them to wash it off maybe after half an hour also. But that is with sensitive skins. But so this is a good peel to use sometimes in sensitive skins, because you cannot use any higher strength alpha hydroxy acids. So we can use this, and they can wash it off after a shorter period of time, like even 30 to 45 minutes. And then slowly you can build up the contact time on subsequent sessions. All right, हो गया आपका. तो अभी 1 घंटे बाद इसको वॉश कर लें. तब तक ये तो मैं आपको बताता हूँ क्या यूज़ करना. So the next peel we will demonstrate is the cocktail. The cocktail peel contains multiple alpha hydroxy acids and a few beta hydroxy acids. So it has glycolic acid, lactic acid, kojic acid, citric acid, salicylic acid. These are the active ingredients. The percentages are will be put on the percentages will be. एक second. Presentation में percentages डाले हैं क्या? PowerPoint में वो if you can display that नहीं cocktail peel का ingredients percentages. Mention the percentages. The percentages will be displayed on the screen. So cocktail peel is a gentle peel with a slightly higher pH, so it's not as acidic as the other peels. It's a polyhydroxy, like multiple alpha hydroxy acid and beta hydroxy acid in a combination. So you have glycolic, lactic, kojic, citric, and salicylic acid. And the indications are for like melasma, acne, and dull skin. So today we are demonstrating on a person who has dull skin. Before we prepare for the treatment, we will clean the face with the pre-peel cleansing wipe. The cleansing wipe has some isopropyl alcohol and lactic acid to enhance the penetration. This is a milder peel, so something to enhance the penetration of the peel uniformly. Vaseline लगाओ, corner of the eyes, corner of the nose and mouth. Wait. We'll apply some Vaseline around the corner of the eyes, the nose corners, and the lip corners. Once the pre-peel solution has dried off, we will layer the peel over. We will layer the peel over the pre-peel solution. So I've taken about 1 to 1.5 ml of the peel solution, and this is a very viscous peel, so the penetration is really slow. Although the package recommendation is to keep it on for 5 to 6 minutes, but I use it for a lot longer because generally the peel is very mild in nature, so you can use it on sensitive skin or skin that has if you put a patient on very strong topical retinoids, then this combines well. So we apply the peel from the we start with the forehead, then move to the nose, and then we work along the sides of the cheeks. The rest of the At all times, you will look for a skin reaction, erythema. You'll watch out for that and ask the patient if they feel too much. If they feel tingling is sometimes what is expected, but if they develop too much burning sensation, then you may need to keep a watch for that. जलन या कुछ हो रहा है क्या? नहीं ना? Mild ना? एक मिनट, just collar ढीला कर. One second, I'll put it till here then. It's important to evenly feather out the peel to avoid any areas of um excessive accumulation of the peel. What's the time? So it's been about 2.5 minutes, and we leave the peel on for about 6 minutes. So the peel contains glycolic acid. So glycolic acid we know is a small molecule alpha hydroxy acid, which has a very good penetration. It's literally it's one of my favorite alpha hydroxy acids in terms of the results that it gives. We know glycolic acid is used in 20%, 35%, 50% to even 70% strengths, and it gives excellent improvement in skin tone, texture. It helps improve pigmentation in hyperpigmentary conditions, very useful. The good thing about glycolic acid is generally it does not cause any visible epidermal exfoliation. The exfoliation is microscopic. So if a lot of patients who don't want any downtime, who don't want any visible peeling, it's an excellent peel where you don't see any visible peeling, you just see brightening after 4 to 5 days of the treatment. And the second peel, that is alpha hydroxy acid that's present, is lactic acid. So lactic acid is uh, it's a very gentle alpha hydroxy acid. It has a larger molecular size than glycolic acid, so it doesn't penetrate very rapidly, and it has a very good humectant property, so it improves the water holding capacity of the skin. It has a very good tyrosinase inhibiting action, so that is very important when you're treating pigmentary conditions, because lactic acid fortunately can, it has a very beneficial in the sense that it has a very important property where it can block tyrosinase irrespective of pH. So that really helps with any pigmentary skin condition. Then you have salicylic acid in the mix, which is a beta hydroxy acid, which helps achieve some amount of epidermal exfoliation. And the other is citric acid. Citric acid again is a mild acid. It's a polyhydroxy acid. So it has a mild, it has a milder, I mean, it has a larger molecule size, so it penetrates, it doesn't penetrate rapidly. So by mixing all of these acids, the whole goal is to achieve good penetration at different levels. So there'll be some which will penetrate deeper, there'll be some which will penetrate a little more superficially. So by putting them all in one solution, you're achieving different levels of epidermal penetration. And the base, that is propylene glycol, helps slow down the whole penetration. It makes the treatment more comfortable, and it restricts the penetration restricts it to the superficial epidermal layers. That's where we want it. We don't want the peel to penetrate very deeply and cause epidermolysis, burns, or PIH after the treatment. We don't want the skin to become too sensitive after the treatment, because ultimately with Indian skin there is a very fine line. If you end up irritating the skin or it ends up penetrating to the deeper layers of the epidermis or the dermoepidermal junction, it can result in post-inflammatory hyperpigmentation. So as you can see, the treatment is quite comfortable. There's no redness, there's no irritation, and overall patients are very comfortable. So this is a good peel for very sensitive skin. We'll start neutralizing the solution. So generally I prefer neutralizing peels with plain water, because sometimes with neutralizer, the reaction with the neutralizer can be an exothermic reaction. Golden is the neutralizer, no? The second round I'm using the neutralizer to sort of wash off any, to neutralize any residual acid. Wait, hold on. इरिटेशन वगैरह कम हो गया? हाँ, हाँ, okay, good. So generally the rule with peels is whenever you start on a peel, always stick. You start off with a lower concentration, and with every subsequent visit, you either increase the concentration or you increase the contact time. So in my practice, we generally stick to the same concentration, but I increase the contact time. If in the first session you can keep it for 6 minutes, you can the next time you can keep it for 10 to 12 minutes or even 15 minutes. That's how it goes. At all times, monitoring lip pe ye karo. At all times, monitoring the patient's skin reaction and asking him for symptoms of any burning. So post peel treatment, we will apply an emollient and a sunscreen, and ask the patient to generally be indoors, not go out in prolonged intense sunlight for at least 7 days. And सिर्फ ये लगाओ, सिर्फ moisturizer और sunscreen लगाओ. So we ask the patient to use emollients for the next 2 or 3 days. With milder peels, we don't ask the patient to really apply a topical steroid. And this their actives can be started after 2 or 3 days. And this peel can typically be repeated at 2-week intervals. So we recommend a series of at least 6 to 8 sessions with this peel. And so they can be this is a good peel that you can combine with other rejuvenating procedures like microdermabrasion, or you can follow it with Q-switch laser, or as part of probably a medifacial. So pre-party peel, so when people don't want too much downtime. So we recommend that you do at 6 to 8 sessions, and at every treatment you can gradually increase the contact time and leave it on for longer for better results. So the next peel we will demonstrate is the black peel. So again, it's a superficial peel, not very superficial, but superficial peel, which is used in the treatment of inflammatory acne. So the peel contains something called as black acetic acid, and that's why it's called as the black peel. So there are varying components to the peel. There's black acetic acid, there's lactic acid, there is potassium iodide, and something called as jasmonic acid. The percentages are listed on the screen. नहीं, उसकी ज़रूरत नहीं. नहीं. So this peel is formed. This is an hydroalcoholic solution, so you don't really need to degrease it because it has a penetrating property. So if anybody has used, it's indicated in the treatment of inflammatory acne, comedonal acne. It's an excellent. It has a lower pH of about 1.1 to 1.2. So one has to exercise some caution when it comes to applying the peel. उनका ये लगा लो, paraffin, Vaseline लगा लो, and ये. You have to be careful on sensitive areas with this peel. Okay, if there is any areas of seborrheic dermatitis or dermatitis around the mouth, you have to avoid those areas or cover them up with petroleum jelly or white soft paraffin, so it doesn't penetrate into those areas. So as you can see, he's got comedonal acne and some inflammatory acne on the forehead, and that is why we are choosing this peel for him. And after the treatment, you can follow it with some comedone extraction. That really helps. You have to be a little faster with this peel because it penetrates rapidly into the skin. Eyes closed ही रखना. इरिटेशन या कुछ हो रहा है? So you can put multiple coats of this peel. Keep it aside. So the solution contains some ethylene glycol, which is again the penetration enhancer, but it makes the solution peel slightly viscous. If you used other brands of black peels, you'll notice that it can be extremely irritating and rapidly penetrating. So the presence of some viscosity agents can slow down the penetration of the peel, which is a good thing. Sometimes people very sensitive skin or a compromised skin barrier can develop intense inflammation. So the peel sort of penetrates slowly. Now, as far as the ingredients are concerned, the black acetic acid, as we know, uh, uh, acetic acid or black acetic acid, it is something that is derived from fermentation of grapes, and which gives it its black color. And it has a very low pH, and it has a very strong antibacterial, antifungal activity. And because of its low molecular weight, it tends to penetrate very well down the pilosebaceous unit. So it has a very good antibacterial activity against Cutobacterium acnes, and because of its low pH, it's a very good keratolytic. The lactic acid in the preparation, और कैसे irritate हो रहा है? नहीं ज़्यादा नहीं हो रहा ना. So नहीं 6 minutes रखते हैं. So because his skin is not, his skin is quite is tolerating the peel well, we can extend the contact time. And then the lactic acid, again, lactic acid itself is a very good antibacterial agent, and it is that's why it's very useful in acne prone skin. In addition, it also helps with PIH. It helps reduce, it blocks tyrosinase, so it reduces PIH. Potassium iodide in the preparation is an anti-inflammatory agent, so it helps speed up the epidermal repair post the peel. And there is a jasmonic acid which is derived from, it's a plant derived acid which has anti-inflammatory effects. So basically jasmonic acid is secreted by plants in order to keep pests away, but it also has anti-inflammatory effects, and that's why it helps reduce some of the irritation that comes with acetic acid. Now typically after the peel, patients may experience some irritation and some dryness and some epidermal exfoliation 2 to 3 days later. So we ask them to use emollients. They can start their anti-acne actives about 3 days after the treatment. And I've had it done on one of my staff members. Although it looks very mild right now, it can cause some amount of peeling after 3 or 4 days. Uh, and this treatment can be followed with comedone expression after the treatment. We have another minute, and the interval of treatment is every 2 weeks. You can call the patient every 2 to 3 weeks, and about 6 to 8 sessions may be required to clear out acne. You can combine the treatment with, in conjunction with oral antibiotics, topical retinoids. Just stop the topical retinoids a few days earlier, or with azelaic acid. So in between treatments, you can give topical retinoids, benzoyl peroxide, azelaic acid creams, or any other combination actives which will anti-acne preparations. And yeah, I think it's 6 minutes, and we will wash off the peel. You can. आँख बंद ही रखना. Wipe. वाइप कर दो. अभी इरिटेशन हो रहा है? नहीं ना, थोड़ा सा रेड हो गया. मॉइस्चराइजर और सनस्क्रीन लगा लो, बाहर लगाने बोलो. So you can see that there's a very mild erythema that comes after the washing the peel. Although the patient didn't complain of any symptoms, there's a very mild erythema. In some black peels, if you've used any other brands of black peels, you can see a visible frosting that may happen on the acne. It doesn't happen with this peel, so don't wait for that endpoint. So that is not your typical endpoint. Here we go by time, because sometimes with Indian skin, it's not it's difficult to evaluate erythema and frosting it with a darker background. And typically, when a peel is completely hydroalcoholic without any viscous, like without any glycols or viscosity increasing agents, you will see that frosting. Otherwise, you will not see the frosting. So don't wait for that as the end point. Right. All right. So like Mandelic Peel. Now, salicylic, Mandelic acid is a large molecular size alpha hydroxy acid, and so that itself makes the so that itself causes slow penetration of the acid into the epidermis, and it achieves uniform penetration. ये कर लो, petroleum jelly लगा लो. Okay. So the Salimira M peel contains salicylic mandelic acid in a propylene glycol and hydroxyethyl cellulose base. Again, a viscosity increasing agents, so that the peel doesn't penetrate immediately into the skin. So it has about 10% salicylic acid and 15% mandelic acid. But when I use although it looks like a mild preparation, but when I use the on some skins, it does cause erythema and a little bit of burning. So I would advise that one should be cautious and when using the peel. Typically, we use a combination of salicylic and mandelic acid. So mandelic acid has a very good antibacterial effect, and so it's used in patients with acne-prone skin. And but because of it being an alpha hydroxy acid, you need, and because of it, this you require some amount of an active a keratolytic agent to enhance its penetration. आँख बंद रखना. Timer start. So we can use it. The indications are acne and acne-prone skin, PIH. Anyone who's anyone who has dull skin or tanned skin. Can also be used as an alternative peel in melasma, where you want a little bit of keratolytic and epidermolytic effect to enhance the penetration of your actives. It can also be used as a maintenance peel after you've treated inflammatory. Once the inflammatory acne has settled down, it can also be used as a follow-up peel to your black peel. Irritation हो रहा है? नहीं. Generally, when we apply peels, we include the neck also to get a uniform result. बर्निंग या इरिटेशन नहीं हो रहा ना, लाइट हो रहा है. So someone with a tough skin, you don't see an immediate irritation. It slowly starts. But in a few patients that I've used, especially when they're on, uh, you know, when you prime them with retinoids or alpha hydroxy acids, you do get very quick this erythema and stinging sensation. So based on how the patient's skin responds, we decide the contact time. It's recommended 5 to 6 minutes, but we can. It depends on how the patient responds. So sometimes we've had to terminate the peel within two and a half minutes also. So based on how that you can extend it up to 5 minutes, but if this patient's skin develops any irritation, and especially with active acne, you can see frosting around on the tips of the papules and around the comedones. Irritation हो रहा है क्या? नहीं. So he's quite comfortable. So we can extend it up to 6 minutes. Sometimes when you wash the peel and as the viscous agents get washed out, then you can experience some burning sensation. So typically with the viscous salicylic mandelic peels, when you wash this, you can experience some sort of irritation. So as I said, you can use it in rotation with other peels such as glycolic peels or black peels. So in melasma and hyperpigmentation, you can use it in rotation with glycolic and lactic peels. In acne, you can use it in rotation with black peels or salicylic peels. People who have sensitive skin with acne, so there you can use that because in rotation with mandelic peels, a lot of times we start off with mandelic peels, but we want a something slightly stronger than just mandelic peels. Then this is a good follow peels. Once you understand that the patient's skin is able to tolerate a milder peel like mandelic, then you can increase the potency of the peel by introducing Salimira M, and it can be used after as a uh, uh, as a layered peel also, where you can use a mild like a very mild glycolic peel about 20%, and then you can layer this over that if you want in cases of acne, or you can do that as spot peel on inflammatory acne. So typically after such a peel, we do see some epidermal exfoliation after 3 or 4 days, because salicylic acid has a keratocoagulant effect. So you can experience some amount of exfoliation after this, and they combine well with the actives. So the actives can be started after the peel, about the third or the fourth day after the peel, and it should be stopped about 3 days before the next peel. It's recommended that you do about 6 to 8 sessions of this peel, spaced at 2 to 3 weeks apart. You can use either this or you can rotate it in combination with any other peel. Right. So 6 minutes are up. आँख बंद ही रखना. Irritation हो रहा है अभी? Mild. So as I said, when you wash the peel, you can experience mild irritation. Where is the neutralizer? And you can appreciate some amount of frosting. Usually the gel vehicle masks the redness and the frosting. So we don't recommend that you increase the contact time beyond 6 minutes. And with Indian skin, it's very difficult to spot skin tones. It's difficult to spot redness. So constantly ask the patient if they are feeling any sort of irritation or stinging. Mandelic acid, if you use plain mandelic acid peels, you'll notice that there can be mild frosting with very superficial frosting with mandelic acid. And you can see there's a, I don't know if you can appreciate, but there's a mild erythema here and occasional areas of mild frosting, which is absolutely okay. It doesn't cause PIH. ठीक है? हाँ, 10 over 20 है. उधर लगा लो. Alright. उधर वो side लगा लो. हाँ जी. There's one a patient who one of my staff members who had done a demonstration peel. एक photo दिया था before after का. Salimira peel. So if you see the yeah. Yeah. So if you can see the difference between the two, the before after, it's about a week later. And Salimira M peel was done, and you can see that there's a very good brightening of the skin, and he had some inflammatory acne, that also a few comedones and papules which sort of settled down and resulting in a good brightening of the skin. So this is with the Salimira M peel done all over the face, and the contact time was about 6 minutes. So with a good amount of brightening. Question and answers. Okay. So so these are the 4 peels that we have demonstrated today, and they have a wide range of peels, but these are the 4 that I like and I use in my practice. So I mean, if there are any questions, I'd be happy to answer them.
Hello. So we are very much thankful to Dr. Rickson Pereira, and now, sir, there are few questions are there from across the country. So
Yes.
just I will throw on you, sir, some. So, sir, first question is like patients on the isotretinoin. Any precautions while applying acne peel? Should we stop isotretinoin for a few days?
Okay. So with isotretinoin, generally what I do is I use only Mandelic peel when it comes to isotretinoin. From therein you can use the cocktail peel, that's a mild peel, and there's no need to stop isotretinoin, but generally what I do is I reduce the contact time because the epidermal penetration is very quick. So I would actually go with and again so you can actually use black peel or the cocktail peel. With the Salimira M, I would be a little careful and maybe not keep it for a very long time. I would probably restrict it to less than 2 minutes. But always remember, when you're treating patients with isotretinoin, apply a very thin film of the peel. Don't put large volumes of the peel at one spot. So ensure that it's a very thin film. You be vigilant about erythema, and constantly ask the patient whether they're feeling intense stinging or this. So although these are very good compatible with patients who have acne who are on isotretinoin, you have to go for the milder peels, reduce the contact time, and continuously monitor the patient so that they don't end up developing PIH. And of course, very important, avoid sensitive areas, especially around the lips. You can put paraffin all around the lip, on the creases of the nose and the under eye. So I would avoid anyone who's on isotretinoin, the areas of thin skin such as the under eye, around the lips and the corners of the nose. I would recommend that you don't apply the peel there and focus only on the affected areas such as the forehead and the cheeks.
Thank you, sir. So there is one more query. If there is the appearance of the hyperpigmentation after the peels, how to prevent it, sir?
So hyperpigmentation can occur because of epidermolysis or full epidermal penetration of the peel. So that can be prevented. We've seen that very commonly with patients who have not been primed. So if a patient who has not been taking care of their skin, if you find that the skin is xerotic, it's sun damaged, they haven't been on a skincare regimen, it's very common in those people, because when you prime a patient, you prime it so that there are a couple of things that happen. When you prime a patient for a peel, you improve the epidermal thickness, the skin barrier becomes more uniform, and in a way, when you prime it, you already sort of calm down the melanocytes. So you achieve, when you prime the patient, you achieve barrier repair, you achieve a calming effect on the melanocytes, so there are lesser chances of having PIH. So never be tempted to start a patient right at the first on the first consultation, and if you're going for the peel, you go for a milder treatment, milder peel at the first instance. Don't go for a strong peel, you will increase the chances of getting PIH. And once you get PIH, of course, if you've noticed on that when you're doing the procedure that for example, if you're doing a glycolic or a lactic peel and you start seeing frosting, you can expect some PIH to happen. Some frosting after salicylic and mandelic peels is pseudo frosting. That's because of the product precipitating out of the solution. But if you see frosting with glycolic and lactic acid, that is true frosting because of epidermal coagulation, and that can result in some PIH. So once you notice that, you can start the patient on a topical steroid, emollients, and strict sunscreen application. Once the epidermis heals and you notice that PIH begins to form, you can continue on a combination of, you can give a combination of topical retinoid and a steroid for a few days, like topical retinoid all over the face or azelaic acid all over the face, followed by steroid application just on the spots. That can help. If you have a Q-switch laser, that is very useful. You can do a couple of rounds of Q-switch laser, maybe once in a week or once in 2 weeks, and that can help clear out the PIH a lot faster. If the patient is comfortable during the day, you can give them a tinted sunscreen, because anything that a sunscreen which has a more broader range of action, not just on UV but also visible light and blue light.
Thank you, sir. Sir, there is one more query. Which peel is best for the periorbital hyperpigmentation?
So periorbital hyperpigmentation is very tricky. You can use the yellow peel and you can use the cocktail peel. Those are milder peels to be used on the periorbital pigmentation. Always remember that with periorbital pigmentation, be very careful because the skin is thin. Prime the patient so that you understand how the skin behaves. Sometimes just with topicals, you'll understand the response to topicals will give you an idea of how the barrier function of the skin is. So if they respond, if they develop irritation and reaction to your topicals, they will definitely react to the peels. So you get an understanding of how the patient's under eye skin is. See the pathology. If it's due to if the under eye area is dark because of atopic dermatitis, then obviously they will have irritation to the peel. So you can go for a milder peel. Like you can go for a yellow peel also, because one thing is there, a yellow peel where it doesn't cause too much PIH. It's quite gentle that way, and the exfoliation is because of enhanced epidermal turnover, not so much due to of its keratolytic effect. So I would recommend that. And if it's due to something like acanthosis nigricans, then you can do like a yellow peel and then follow it with repeated treatments with cocktail peel. So those are recommended. And Of course, the Amira range contains other strengths of glycolic and lactic acid. Those are something that you can try. Lower strengths of glycolic, lower strengths of lactic. I find lactic also very useful around the eyes because the penetration of the peel is a lot slower, and it has a good tyrosinase activity, anti-tyrosinase activity, and a good when you do peel successfully, you improve the whole you trigger the synthesis of ground substance, hyaluronic acid, glycosaminoglycans in the skin, and that improves the skin quality. So we see a good effect of that with glycolic and lactic peel. So that is something that you can try. So I would say with under eye peel, a good a cocktail peel or a glycolic peel or a lactic peel or a yellow peel. You can try different combinations, or you can use one peel in rotation and different peels in rotation, or you can use the same peel and increase the contact time with every subsequent session.
So there is one more queries. Patient on the isotretinoin, any precautions while applying acne peel? Should we stop isotretinoin for a few days?
That we already answered.
Okay, sorry, sir. Sir, one more. Sir, someone please repeat, sir, how to neutralize the black peel. How to neutralize the black peel?
So this is a general rule that I follow. I always reduce the acid load by first washing it with plain water, because you know that the reaction with the neutralizer is an exothermic reaction, and if the peel has penetrated deeper at any spots, you can actually get a full burn, then full epidermal epidermolysis or epidermal burn. So, and you can get these foci. Typically, a patient will tell you that after 2 days that there are black spots have developed. So I generally reduce the acid load first by washing once or twice with plain water, and then the third round I put neutralizer to sort of mop up any residual acid. So I would say that use plain water first and 1 or 2 rounds, and then follow it with the neutralizer containing 5 to 15%, anywhere from 5 to 15% sodium bicarbonate.
So one more queries. How long will the contact time for the underarms in case of yellow peels?
So you can actually on the underarm you can do a couple of things. As I said, you can actually follow the protocol where you apply the vitamin C solution followed by the yellow peel itself. So you can leave it on for at least 1 or 2 hours. As I said, you start, everybody's skin is different. I would recommend that you start with the recommended time first, and then on subsequent session increase the contact time. So I would keep it for maybe up to 2 hours at the first go. And you have to understand how the PIH has come. If it is because of acanthosis nigricans, you can leave it for a longer time. But if a patient has developed PIH due to some dermatitis, then you would shorten the contact time to an hour and then wash it out. A lot of the times you can even combine it with a short contact peel. Like you can do like a 20% glycolic first, wash it out, and then apply the vitamin C and the yellow peel. But there I would recommend that you reduce the contact time to an hour. But it achieves good penetration of the yellow peel and exfoliation.
Sir, like which peels can be used for brightening?
So out of which the cocktail peel can be used and Salimira M can be used. There are other peels in their range which you can use, such as the glycolic and the lactic peels. But I generally like the cocktail peel. You can do because the thing is that it's not very see, when we are practitioners, sometimes it's not with the busy practice, it's not always possible for us to do each and every peel, and sometimes you want to delegate that work to your associate doctors. I always in my clinic it's always doctors who do the peels, but it's always a good thing to start with the cocktail peel. As I said, you can start off with a cocktail peel 1 or 2, understand the patient's skin, and then you can interrupt it with a yellow peel treatment, and then again for maintenance you can do a cocktail peel. Or if you've been doing cocktail peel and you want something a little more intensive, then you can do interrupt it with the Salimira M peel, and then so there are multiple combinations. But I would recommend brightening. If the patient can't come very often to your clinic, then I would recommend a yellow peel would be very good. It gives very good results.
Thank you, sir. Sir, is thioglycolic acid peel available in the market?
Thioglycolic acid peel is not available in the market.
Okay.
I'm not aware. Maybe I'm not aware of it. I only know it's there in hair rebonding and straightening products. I don't know.
Correct.
And hair removal creams. I'm
Thank you,
not
sir.
aware of thioglycolic peels.
So, sir, like which priming agent is best, sir?
So it depends on what is the indication that you're treating. With acne, I prefer topical retinoids. With melasma, I prefer azelaic acid. With acanthosis nigricans, it's always a combination of sometimes I like ammonium lactate or a strong glycolic acid cream on the body. So it varies based on the indication. I generally don't. Sometimes it's a combination of like a depigmenting agent containing kojic acid or say kojic acid, glycolic acid, and hydroquinone. So it can vary depending on the indication. But according to me, I restrict the number of or even butyl resorcinol derivatives. Resorcinol and its derivatives, those are used for depigmenting. If you ask me, acne, retinoids, melasma, I like azelaic acid, and any body this I would use ammonium lactate or a glycolic cream on the body.
So, sir, one question is from Dr. Amravati. Discuss the management of under eye dark circles.
So as we all know, under eye dark circles, the causes can be varied. It can be due to atopy, it can be due to acanthosis nigricans, it can be an extension of pigmentary demarcation line, it can be frictional because of constant rubbing. So treatment is based on the etiology. If there is a darkening as well as hollowing, then the treatment modality changes. So based on the etiology, you would like a general consent for the under eye skin would be management of the skin barrier. So a good emollient. Gentle under eye creams containing lower strengths of retinol or lactic acid or peptides. Those are now varying combinations are available. Low strength of retinol, like instead of retinoic acid on the under eye, I would prefer a retinol containing lactic acid, vitamin C, peptides. All of these are available in the market. So varying combinations are available. So they are quite good. During the day, I ask a patient if it's possible to wear a sort of a concealer, because that almost works like a sunscreen for the under eye area. So a night cream, a concealer during the day, and as far as treatments are concerned, I like peels a lot for under eye area, because you can go right up till the lid margin, unlike Q-switch where you cannot go up to the lid margin. So I use 20% glycolic acid up to 35% lactic acid. You can use the cocktail peel, you can use the yellow peel. I would say with once your the underlying etiology has been assessed and you get an understanding, you can choose your peel based on that. If it is acanthosis nigricans, I would probably go for a yellow peel. If it is due to dermatitis, post-inflammatory hyperpigmentation due to dermatitis, I would probably try something like a cocktail peel on the under eye area.
Sir, like one question is, which peel do you recommend it for the keratosis pilaris?
Pilaris. So keratosis pilaris, we all know, is a very difficult condition to treat, and it requires lasting management. Like long, it goes on for a really long time. The management. So I generally prefer higher strengths of this alpha hydroxy acid. So I go up to 50 to 70% glycolic acid, and I leave it on for a longer time. Like the contact time could go anywhere between 10 minutes to 15 minutes. And I also do once in a while. I also do TCA, 10 to 15%, which achieves some good epidermal exfoliation. So yeah, I would use a higher strength glycolic acid or a low strength TCA from time to time, and the peels need to be repeated frequently to get a good amount of where I don't promise them that it would go away completely, but we are only looking at lightening and reducing the bumpy appearance or the spiny feel of the skin.
So thank you so much, doctor. You have almost answered all queries of the delegates across the country, sir. So once again, on behalf of Solderma Pharmaceuticals Limited, we are very much thankful to all the delegates who had attended this live peel workshop. And at the same time, we are very much thankful and we are very much appreciation by to Dr. Rickson for giving his precious and valuable time and making this event highly successful, sir.
Thank you. Welcome. Thank you for having me. Thanks for everyone who joined in for taking time out on a Sunday to join us for this workshop.
Thank you so much. Thank you so much, all delegates. Thank you so much.
Thank you.